Hello everyone, I'm Dr. Rohini here. I'm going to talk about the carpal bones. So here you can see all these carpal bones. So there are proximal and distal row. One important bone that I'm going to talk about is scaphoid. So this is the scaphoid bone. Scaphoid lies at the radial border of the proximal carpal row. So here you can see the scaphoid bone, which is peanut shaped. And here are the parts of the scaphoid. You can see the tubercle here. This is the tubercle, and it has got two poles. There is a distal pole and a proximal one. There is a distal pole and a proximal one, and you can also see there is a facet for the attachment or articulation with the capitate. Then there is another one with the lunate here. Okay, so this is the scaphoid bone. So scaphoid articulates with five bones. So it articulates with the radius, it articulates with the trapezoid, trapezium, lunate and capitate. So here you can see there is an interesting fact that you should know about the scaphoid, the blood supply. So what is the blood supply? So there is scaphoid, that is primarily solo blood supply is by the radial artery. The dorsal branch provides 70 to 80% of the blood supply to scaphoid. It enters the scaphoid through the foramina on the dorsal ridge. So there is a foramina on the dorsal ridge. It enters through the dorsal ridge foramina. These vessels divide and run proximally, primarily to supply. So it is on the dorsal ridge and it runs proximally and palmarly to supply the blood to the proximal pole of the scaphoid. So it is overshooting and coming backwards to supply the proximal end. So the volar branch will provide about 20 to 30% of the blood flow, and it either directly from the radial artery or from it's one of the branches. So the proximal pole has retrograde blood supply, therefore it is dependent entirely on the intraosseous blood flow. And there is always a high risk of non-union and osteonecrosis after the fracture. So this is one of the bones which is very volatile for fractures. So it is called avascular necrosis of the proximal scaphoid. So this is an interesting fact about scaphoid.